The House Health Policy Committee will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter.
Here.
Hadsma.
Here.
Neely.
Here.
Glanville.
Here.
Coffea.
Here.
Conlon.
Here.
Farhat.
Here.
Fitzgerald.
Here.
Miller.
Here.
Reingans.
Here.
Vanderwall.
Present.
Filler.
Yes.
Mueller.
Here.
Van Workum.
Here.
Roth.
Here.
Schmaltz.
Here.
Thompson.
Here.
Madam Chair, you have 19 members present. You do have a quorum.
Thank you. Representative Conlon moves to approve the minutes from our meeting on March 5th, 2024. Seeing no objection, minutes are approved. Prior to testimony and votes, if you wish to speak or express your position on legislation before us today, please submit a card to the clerk. Sergeants in the room will be happy to collect the cards and get them to the committee clerk on your behalf. In the interest of time, if you are welcome to submit written comments to be submitted to the bill record. First, we will hear testimony on a two-bill package, Senate Bill 449 and 450, regarding complex rehab technology. Finally, we will have votes on House Bills 5013, 5345, and 5346 in regards to contraception access, which we heard testimony on at our previous meeting on March 5th. First, we will hear testimony on SB 449 and 450, sponsored by Senators Daley and Irwin, to regulate how customized medical equipment is provided to residents. To testify in support of these bills, we will have the bill sponsors, followed by Court St. John, Rehab Director at CareLink Medical, Barry Cargill, President and CEO of the Michigan Home Care and Hospice Association, and then Dr. Jenna Colin, physical therapist who specializes in individuals with disabilities needing this type of equipment, who will testify on Zoom. To speak to their bills, we will have bill sponsors Senator Irwin and Daley. Welcome to Health Policy, and begin when you are ready. Thank you.
Thank you, Madam Chair, and members of the committee. Senate Bills 449 and 450, sponsored by myself and Senator Irwin, will better serve children and adults with complex medical needs enrolled in the Medicaid program. Specifically, these bills would create recognition for complex rehab technology as a separate category in the Michigan Medicaid program. This new category would include specialized, often individualized equipment for a subset of disabled Medicaid clients whose equipment needs are presently provided through the durable medical equipment benefit in Medicaid. CRT products include medically necessary and individually configured manual and power wheelchairs, seating and positioning systems, and other adaptive devices that require evaluation, fitting, and configuration, adjusting, or programming. These specialized products are used by a small group of people with high-level disabilities and chronic medical conditions. Access to CRT allows these individuals to manage their medical needs, minimize their health care costs, and maximize their independence. It also helps the state keep health care costs down by reducing medical complications, clinical interventions, hospitalizations, and caregiver needs. There are also substitutes to these bills which would make life easier for our rural constituents who may be geographically isolated from durable medical equipment providers. Thank you, and I wish to turn it over to Senator Irwin.
Thank you, Senator Daley, and thank you, Chair Rogers, and all the members of the committee for giving us a little bit of your time today. I've had the pleasure of working with Senator Daley on this bipartisan package of CRT bills for a number of years, and I'm really glad to be getting this far in the process again. I think Senator Daley explained it thoroughly. The only thing I could really add to that is that the changes that were made, that were requested by the department, I think sort out some of the concerns that folks had about how exactly do we define whether or not these services are available to people. So that's what's in the subs. And then also I would just sort of emphasize what Senator Daley said about the importance of this. You've got a small number of folks in our state who rely on Medicaid who also have complex rehabilitation needs. And if we are not going to meet their needs with customized equipment that actually support their health long-term, then as Senator Daley pointed out, not only will their health conditions worsen and not only will that add to our costs in the Medicaid program, but it also immiserates these individuals' lives. I mean, these are folks who are already suffering from conditions that put them into a wheelchair, and if that wheelchair is not customized to meet, their specific needs for how they sit, then it just becomes a chronic problem that becomes chronically expensive, as the senator pointed out, but it's also terrible for their lives. So, this is a way I think that we can improve our Medicaid services for a small number of folks who have complex needs in Michigan, and appreciate the opportunity.
Do members have questions for the bill sponsors? Keep in mind we do have some technical experts up as well. Representative Roth.
Just quick, gentlemen. How far has this gotten in the process so far? And has there been how do I say this correctly? Has this bill been vetoed before, and what are the concerns of it?
So
Why
this,
it was vetoed,
this
sorry.
bill has made it through the process before and was, I think, pocket vetoed a couple years ago, very late in the process. I think that the changes in the sub that represent the department's interests in more carefully characterizing what it means to be geographically unavailable addresses the concerns that the administration had and should hopefully allow it to get all the way through the process. I think in the intervening years, there was also a time where it made it through the Senate but wasn't able to get through the House. So there's been some fits and starts. Hopefully this is the year we get it done, and appreciate the committee's time.
Appreciate the information. Thanks, you guys.
It was pocket vetoed, but it did make it through the Senate last year, and then because of the end of the term, or last term, excuse me, it never got through the House.
Thank you.
Any other questions from members? Otherwise, we'll move along and we'll have another opportunity. Thank you. Thank you so much. Next up, we have Court St. John, Rehab Director at CareLink Medical, and Barry Cargill, President and CEO of the Michigan Home Care and Hospice Association. Welcome to Health Policy, and begin whenever you're ready.
Good morning. Thank you for having us. I'm just here to take on questions that you may have on behalf of our industry, based on the testimony you've already heard from the two senators, who I think covered everything pretty sufficiently. Do you have anything else?
Before we get in, if both of you can address us, and then we'll ask for questions.
Okay.
Sure. Thank you, Chairman Rogers, for our hearing today, as well as the committee. We very much appreciate being before you to share the importance of this legislation. Representative Senator Irwin and Daley, I think, relayed this very well, so I'm not going to repeat a lot of the things that they said, but it is certainly an important legislation. Combined, Senate Bill 449 and 50 will establish a separate recognition under the Michigan Medicaid for complex rehab technology, so that access to these critical services can be protected for the children and adults that have significant disabilities. Improved policies and provider standards will go a long way to result in stronger safeguards, better outcomes for our state Medicaid program, patients and beneficiaries, and ultimately to keep costs down, keep them out of the hospital, keep them so that they're able to live their daily lives. Complex rehab technology is different than regular standard durable medical equipment. The traditional durable medical equipment Medicaid benefit and the related policies, they were created over 50 years ago. Since that time, we've had significant advances in the durable medical equipment, which we refer to as complex rehab technology, and its ability to be individually configured for the patient to help them in their recovery or in their needs. Could be any number of things, but this small population of children and adults needing these special CRT products and services. They have disabilities such as ALS, cerebral palsy, multiple sclerosis, muscular dystrophy, spina bifida, spinal cord injury, traumatic brain injury, and it's a much longer list. They depend on this individually configured equipment to address their unique medical needs and to maximize their function and independence, and essentially to minimize their health care costs. And Senate Bill 449 and 450 are not anticipated to increase state costs. The fiscal agency, both in the Senate, now today I did read the one that the House came up with as well. I think they're very consistent in indicating that the cost to this is minimal. But it is important, I think, for the individual patients and, essentially keeping them living their lives out of the high-cost hospital situations. With that, I'd just like to thank you for this opportunity to be with here today. Court St. John is our expert here and would be able to answer certainly any of the technical questions that you may have as well. So with that, I thank you so much, as well as Senator Daley in Irwin for their diligence in sponsoring this legislation and being with you here today.
Thank you so much. I see Representative Conlon has a question.
Thank you, Madam Chair, and thank you for your testimony today. I just was wondering, you said a small number. What is the kind of population that is in need of this, and what did we do before? What is the current policy?
Well, the current policy is that it's essentially left to the discretion of Michigan Medicaid staff. And over, the 50 years, I guess, durable medical equipment has just continually advanced. And it is the individual configuration that is unique here, in that every patient is different. And being able to individually configure that durable medical equipment product or the complex rehab technology equipment product that is needed in order to meet those individually configured needs. I'm not sure exactly what the population is. It's significant. I know there's a number of Medicaid patients that utilize this, and as technology advances, it's so important that we have the individually configured equipment to keep them out of longer hospital stays.
And could I just add, this is the type of equipment that is already supplied and covered by the state. We're just asking that DME suppliers such as us have someone certified on staff that's specifying the equipment to provide the best outcomes, to prevent medical conditions and hospitalization beyond.
Thank you. Any other questions from members? I have a question. Can you explain a little bit about the opposite of what happens when this goes south? So also, I'm not sure that members understand how often. So like, let's say you were provided with a custom wheelchair and it didn't fit, or you used it for 6 months and decided you wanted to just go get another one. Could you do that? Does insurance cover that? Can you explain a little bit about that?
Well, that's part of what we try to avoid, in that if it's done with a team, including a physical occupational therapist, a physician, and a certified assistive technology provider, it's done right the first time to prevent those complications. For example, some of these systems have powered seating systems that provide pressure relief. And if they're not prescribed correctly, they can end up with skin breakdown and end up in the hospital with a $200,000 bill for healing, when it all could have been prevented if the equipment was prescribed correctly to begin with.
Thank you. If you don't mind staying up there, I think we're going to go to our Zoom testifier, and then we'll do one more round of questions. So next up, we have Dr. Jenna Colin, physical therapist and manager of rehabilitation services at My Michigan Health, with a patient and provider perspective. Welcome to Health Policy. Begin whenever you're ready.
Thank you so much, and thank you for the opportunity to come and speak to the committee. I'm kind of speaking on this from two different perspectives. So I do work for My Michigan Health, which is a health system based out of Midland, Michigan, but we have subsidiaries that stretch all the way up to Sault Ste. Marie. So we're kind of that rural perspective. I'm also a physical therapist, and I do oversee several outpatient and acute care departments. So I do have a pediatric clinic that is solely focused on pediatrics. So we see kids all the way from birth to 18 for all kinds of diagnoses. A lot of them are very complex. So I was very excited to see this bill come across. Again, looking at it from the perspective of a PT, and that we specialize in, and we see these patients, especially for pediatrics, we see them for years, year after year. A lot of times these are long-term cases that they require rehabilitative interventions, for a long time. My only concern with the bill was about patient access in these more rural areas, because there are 83 certified assistive technology professionals in the state of Michigan, but there's only one in the UP, as an example. And so some of the changes that were outlined in Senate Bill 450 really helped to alleviate that, because as physical therapists, as a PT, we would be involved in the analysis, the needs, the measurements, looking at, like in our pediatric case, what a child would need in terms of a power wheelchair, as an example, what they need at home versus what they need to be able to attend school. I brought up an example of a 8-year-old that we were assessing for a power wheelchair that was in a motor vehicle accident. Obviously, it happened very suddenly and unexpectedly, and we needed a power wheelchair, and this was right during the week of Christmas. So it was difficult to try and coordinate with our certified assistive technology professional and the PT. And so I just wanted to make sure that as part of our qualified healthcare professionals, that PTs would be included in that to work directly with the supplier and really outlining the need for the assistive or the complex rehabilitation technology that they would need, like the power wheelchair. And so all that is included in this bill, which really helps to increase patient access. In our areas like Grand Rapids and Metro Detroit, I mean, there are a ton of certified professionals. But as you move further north and more rural, that's where I really wanted to make sure that this bill was able to capture the need for patients that do need these individually configured technology, and we would still be able to give that to them in all areas of the state. And I also am thinking that this type of legislation would encourage suppliers to employ more certified professionals because it really works best when we work together as a team, as was already discussed. When you have the certified professional, you have the PT, the physical therapist or the occupational therapist, the physician, everyone together is really what gives the patient the best outcomes. So I'm excited and was invited to speak here on behalf of APTA Michigan, the American Physical Therapy Association of Michigan. So I'm very excited for this opportunity to express my support and our support overall.
Thank you so much. Do members have any other questions? All right, seeing none, we will move along. Thank you to everyone who testified today. My intent is to take these bills up very soon for a vote, so please reach out to our offices or the senators with questions.
Thank you.
In support of Senate Bills 449 and 450 is the ALS Association and APTA Michigan. I would like to recognize students here from Green Hills School. Welcome to Health Policy, and thank you for joining us today. Next, we will take votes on the contraception package of bills that we heard testimony on last month. House Bills 5013, 5435, and 5436. There are a few changes to House Bills 5013 that I would like to outline. The substitute will clarify that the 12-month supply of prescription contraceptives are for ones covered in the insured's health plan formulary, furnished or dispensed at a pharmacy in the insurer's network all at one time. Clarify that insurers must not impose utilization controls or other forms of medical management that limit the 12-month supply unless the U.S. FDA determines that a 12-month supply is medically inappropriate. Not require insurers to provide coverage for a 12-month supply in the 1-month period before the end of the insured's plan year, and move the effective date from 90 days to December 31st, 2025 to allow sufficient time for implementation. And to speak to changes in the substitutes on their bills, we have Representative Young and I believe Angie from Representative Hope's office, if you would like to join and begin when you are ready.
Good morning. Thank you, Madam Chair. Thank you, committee members. Just a few changes. So to House Bill 5435, thank you for the opportunity to explain the changes and the proposed substitute that is before you. Briefly, the substitute clarifies a few things. That the contraceptives prescribed and dispensed by a pharmacist are at a pharmacist that is in the insurer's network. That the coverage provided will also cover consultation by a pharmacist. The substitute removes language that would allow coverage for applicable testing. Additionally, It adds language to require that coverage be consistent with coverage of other prescription drugs under the insurer's health insurance policy. Moves the effective day from 90 days to December 31st, 2025 to allow sufficient time for implementation. This substitute incorporates feedback from members and stakeholders. I think it's a good compromise, and I look forward to the committee support. Thank you.
Thank you.
Thank you, Chair Rogers. The substitute, the H2 sub for House Bill 5436 allows Lara 18 months to promulgate rules, adds language that lets the rule promulgation process determine if a different pharmacist can dispense the hormonal contraceptive than the one who prescribed it, adds language so that emergency contraception is covered under this bill, clarifies language to prevent pharmacists from knowingly dispensing hormonal birth control to a patient after their death, and finally, it removes the 90-day effective date. Thank you, Chair Rogers. Those are all the changes in this sub.
Thank you very much, and we do have some cards to read in. Opposing 5013 is Michigan Chamber of Commerce. Supporting 5435 and 5436 is Michigan Nurses Association. Supporting HB 5013, 5435, and 5436 is the YWCA of Kalamazoo. Supporting the bill, all three bills, is Authority Health. Supporting all three bills is ACOG. Supporting all three bills is AAUW of Michigan. Supporting all three bills, YWCA of Kalamazoo. Supporting all three bills, Michigan Unitarian Universalist Social Justice Network. And supporting all three bills, Michigan State Medical Society. Representative Neely moves to adopt H3 substitute for HB 5013. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. The substitute is adopted.
Thank you. Representative Neely moves to report HB 5013 with recommendation as substitute H3. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
No.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
Pass.
Schmaltz. Thompson.
No.
Madam Chair, you have 12 yeas, 2 nays, 5 pass. The motion prevails.
Representative Farhat moves to adopt H1 substitute to HB 5435. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller. Yes. Reingens.
Yes.
Vanderwall.
Yes.
Filler.
Yes.
To adopt this. Mueller.
Yes.
Van Workum.
Yes.
Roth.
Yes.
Schmaltz.
Yes.
Yes. Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Farhat moves to report HB 5435 with recommendation as substitute H1. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Whitsett.
Yes.
Carter.
Yes.
Hadsma.
Yes.
Neely.
Yes.
Glanville.
Yes.
Cuffia.
Yes.
Conlon.
Yes.
Farhat.
Yes.
Fitzgerald.
Yes.
Miller.
Yes.
Reingens.
Yes.
Vanderwall.
No.
Filler.
Pass.
Mueller.
Pass.
Van Workum.
Pass.
Roth.
No.
Schmaltz.
Yes.
Thompson.
No.
Madam Chair, you have 12 yeas, 3 nays, 4 pass. The motion prevails.
Representative Glanville moves to adopt H2 substitute to HB 5436. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 19 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Vanderwall.
Thank you, Madam Chair. I have an amendment for 5436 that would change where it says individual to, regardless of the individual's age, to who is an adult.
All right, Madam Clerk, please take the vote on amendment number 1 to HB 5436.
Chair Rogers.
No.
Representatives Witsett,
No.
Carter,
No.
Hadsma,
No.
Neely,
No.
Glanville,
No.
Cuffia,
Nope.
Conlon,
No.
Farhat,
No.
Fitzgerald,
No.
Miller,
No.
Reingens,
No.
Vanderwall,
Yes.
Filler,
Pass.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 6 yeas, 12 nays, 1 pass. The amendment did not prevail.
Thank you. And I believe Representative Thompson has amendment number 2.
Yes, thank you, Madam Chair. My amendment is very simple. It would just state that once the pharmacist has prescribed a 12-month prescription of contraceptive, that within 2 years, the individual would show proof of having been assessed by a physician under the care of a primary care physician to ensure that everything is safe with the continuation of said prescription.
Thank you. Madam Clerk, please take the vote on amendment number 2 on HB 5436.
Chair Rogers.
No.
Representatives Witsett,
No.
Carter,
No.
Hadsma,
No.
Neely,
No.
Glanville,
No.
Cuffia,
No.
Conlon,
No.
Farhat,
No.
Fitzgerald,
Nope.
Miller,
No.
Reingens,
Nope.
Vanderwall,
Yes.
Filler,
Yes.
Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yep.
Madam Chair, you have 7 yeas, 12 nays, 0 pass. The motion does not prevail.
Thank you. Representative Glanville moves to report HB 5436 with recommendation as substitute H2. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat,
Yes.
Fitzgerald,
Yes.
Miller,
Yes.
Reingens,
Yes.
Vanderwall,
No.
Filler,
Pass.
Mueller,
No.
Van Workum,
No.
Roth,
No.
Schmaltz,
Yes.
pass. Thompson.
No.
Madam Chair, you have 12 yeas, 5 nays, 2 pass. The motion prevails.
I don't believe we have any absent members today, so there being no further business before the committee will stand adjourned.